Hey everyone, Jessiana Seville here from thekidneyrd.com. Coming in here tonight to talk about gout and chronic kidney disease. So I just did a little live on Instagram, now coming in to talk to our groups, Facebook, YouTube, and to share a little bit about this really important topic. Now, if you don't know me, I'm a registered dietitian, real nutrition expert. Our team of dietitians is at kidneyrd.com, and our team helps people find answers to their kidney disease so that they can preserve their kidney function. We love, love, love what we do. But tonight we're going to talk about gout, uric acid, really, really huge part about this. So let's get going on this. And I'm sorry, I always pull up my notes while I do this to make sure I don't forget anything. Number one, so what is gout? Gout is a condition where uric acid is in the bloodstream and it starts to form these little crystals, right? Crystals in the body are not good. With polycystic kidney disease, we talk about oxalate crystals, but uric acid crystals are equally important. And with gout, that is what caused this agonizing pain that people have. Often deposited in the big toe, but not always. Now, gout can cause joint pain, it can cause redness, heat, stiffness, and even the development of these little bumps called TOPHI. High uric acid also can cause kidney stones, and hard to say what is the chicken or the egg here, but it is definitely related to kidney disease and kidney decline. One of the labs that we have that we request all of our patients get is a uric acid level. It is not drawn on everyone. If they don't have gout symptoms, then you don't always get a uric acid level drawn, but it is 100% a very important lab to look at if you have any type of kidney disease, because high uric acid levels will drive the progression of the kidney disease. It also gives you a really good picture into where some of the problems might be with your kidneys. So uric acid level, if you've never had one, have your doctor draw one. Now, gout is a result of high body waste. You know, this uric acid is a body waste, and it can be affected by a lot of different things. The one that you most often hear about are high purine meats and red meat, shellfish, sardines, anchovies, a diet that's high in fructose, particularly high fructose corn syrup, people that are heavy soda drinkers, especially like regular soda, or they eat a lot of packaged sweets. That high fructose corn syrup especially can be a huge driver of uric acid. Excessive alcohol, dehydration, hydration. For a fundamental core principle of good kidney care is adequate hydration. Absolutely critical. Whether or not you have gout, and it doesn't matter who you are, even if you have kidney disease, hydration is really, really critical. In kidney disease, we make it a top priority focus. Other health conditions are definitely associated with gout, like obesity, chronic kidney disease, hypertension, cardiovascular disease, and some medications can drive gout attacks as well. Now, let's talk about gout and chronic kidney disease. Now, high uric acid is very prevalent among those with chronic kidney disease, and it's not sure which is what, right? Is it that the uric acid drives the kidney disease, or is it that kidney disease drives high uric acid levels? I honestly think it is both, which is one reason we hone in on it. Those with gout are at almost they're at an increased risk of chronic kidney disease, right? And people with chronic kidney disease are at an increased risk of gout. So about 70% of your uric acid secretion occurs in the kidneys. So you can see why there's this huge association there. As your kidney function declines, you're not going to have as much uric acid filtered out. So again, another reason there's a huge association there. One of the other things here that can drive uric acid levels, this other piece that is not always looked at, especially in conventional medicine, it can be gut health, right? A leaky gut can be a part of uric acid levels. Candida, mold exposure, mycotoxins are a big uric acid driver. And we've also seen food sensitivities be a driver of gout as well. That's one of the things we do, is help people really figure out what is this core issue when it comes to the gout and food sensitivities can be very, very enlightening, and it is one way to find the triggers. Sometimes people are like, I'm taking Uric and I'm taking this other thing, and I don't eat red meats, and I don't eat any foods with high purines, I don't eat high fructose syrups. I don't know why I still get flares. And that is where doing a little bit of a deeper dive can be really, really helpful. So a couple myths here, right, around uric acid, gout, chronic kidney disease. Number one of the big myths that circulates out there is that only men and obese people get gout, which is not true. Definitely men are at a higher risk for gout, but women, especially during menopause, can also be quite at risk. So, and again, other risk factors that we talked about: older age, diuretic use, hypertension, obesity, metabolic syndrome, and type 2 diabetes. A lot of risk factors there. And again, it's hard to say what is the chicken or the egg here. Uric acid production is definitely an inflammatory response, and all of those chronic conditions are inflammatory. Another myth: if I'm already taking medications, right, I'm on allopurinol, I'm on Uric, I don't need to watch what I eat. Now, we 100% stand firm that dietary changes are a foundation of good health. Your medications should not be the foundation of your good health, although they can be a very important part of a management strategy. But diet is always a foundation of health, because health is not just about not having gout attacks, right? Health is about your overall life, all right? Being able to sleep, being able to find food you like, being able to have energy to do the things that you want to do, that is health. And having a quality diet is really foundational to that. It's one of the things that we really focus on with our patients, is this lifestyle change, right? When people work with us, we want them to leave and feel like they have changed their life, not just that they have changed their diet, even though we do definitely both of those. Other big myth: gout only affects the big toe. Again, usually the big toe is affected first, but gout can show up in any joints, and uric acid crystals can even deposit in the kidneys as stones. Ouch. Both of those. Ouch, ouch, ouch. So a couple things that you can do. Really some basics here. Basics. Number one, if you eat a lot of red meat, pork, beef, lamb, any of those, removing those can help reduce your purine load and reduce gout attacks. Reducing some seafood like sardines, anchovies, and shellfish also can help reduce the incidence of a gout attack. Now, interestingly enough, there are vegetables that are high in purines, but the research does not show that the high purine vegetables drive gout attacks or high uric acid levels. So we really encourage patients to eat, a predominantly plant-based diet. That is what we're teaching them, how to implement, how to make it work with their life, how to really love and enjoy it. Definitely some controversy around purines in plants and uric acid, but I have not found the research to be compelling that vegetables high in purines are a huge causative factor. Food sensitivities could be, though. Another thing that I feel like is also pretty easy to do: taking the fructose, right, in any form, especially high fructose corn syrup, out of your diet. Now, predominantly, this is going to be sweets, sodas, packaged desserts, and if you're for some reason a very, very heavy juice drinker, or maybe you're drinking like those really fancy smoothies, where they have the Bolt House or the Naked smoothies, and they're like loaded with a ton of fruit in there, that potentially could be problematic for you, because it's a lot of fructose in one dose. Limiting alcohol can be really helpful, especially beer. Drinking enough water. When it comes to hydration, having your fluid and your drinking triggers is really, really helpful. So for example, and if none of you guys have read Atomic Habits by James Clear, 100% recommend that book. So if you're not good at drinking water, I have people say that I'm just not good at drinking water, I forget, I get busy once I get to work, etc. I'm just not going to focus on it. Get your hydration associated with things that you always do and know you will always do. For example, brushing your teeth. Every single morning you're going to brush your teeth, or hopefully you are. Most people are in a good habit of that. You can keep a water bottle, or I really like the hydro flasks. You can fill it up with ice. It will stay cold all night long. But you can get a water bottle, put it next to your toothbrush, and in the morning after you brush your teeth, or before you brush your teeth, drink 8 to 12 to 16 ounces of water to get going for the day. When you get in your car, bring your water bottle. You know, you can drink at the stoplights. Make sure that you have some sort of water with your meals, right? That can also be very, very helpful for you. So drinking enough, getting enough hydration is absolutely critical. If you struggle with getting up at night because you're like, yes, I'm a hydration champion, you've been drinking water all day, and then you're up 4 or 5 times during the night peeing, you can give yourself a deadline or a cutoff mark, maybe after 6 or after 7 p.m. You put the fluids away, and that's okay. You can stay hydrated even if you're not drinking all the way up into bed and while you're sleeping at night and every other time. It's okay. You don't have to drink 24 hours in the day. And then, of course, always a good idea, talk with your medical team about any other measures. Make sure you get that uric acid level drawn. You can reach out to us. We'd love to work with you. If gout is something that is really dogging your heels, we'd love to work with you to kind of deep dive into that. Food sensitivities, genetics, you know, whatever is the driving factor. If you've tried everything and can't figure it out, that is something that we can 100% help you with. So as a finale, we always put a recipe with the week. Typically, Caesar salad has anchovies with it. We, however, have an amazing Caesar salad on our website, plant-based Caesar salad, that you can use. It's the creamy keto Caesar salad. It might have a little bit of yogurt in it. It's a fan favorite. A lot of our patients love that particular recipe. We're really proud of the recipes that we put out on our blog. They're beautiful, they're delicious, and definitely ways that you can enjoy the food you have, even if you feel like you have some limitations. So that's it for tonight. Please, if you have questions, drop them below. We'd love to answer those. If you found this helpful in any way, then please share with a family or friend or in any groups that you might be in. And if you're watching this from YouTube, then we always appreciate a like and a subscribe. That's it for tonight. We'll talk to you later. Bye-bye.